So let's talk about 4 considerations that you might need to take when you're training a client that might be breastfeeding. So the first consideration is about relaxin. Relaxin is the hormone that gets released into the body as you become pregnant, and it's at its highest during the first trimester. It then steadies off during the second and third trimester, but remains in the body for at least 5 months post-birth, and that's going to be even longer if someone is breastfeeding. Now, the World Health Organization actually recommend women breastfeed for up to 2 years of the baby's life. So that means that there's likely to be a level of relaxin still within the body for anywhere up to 2 years, depending on the mother. So we need to take it into consideration. If you remember what relaxin does, is it relaxes all of the ligaments and the connective tissues in the body, allowing for the changes required during pregnancy and to make labour easier. So we see changes in postural stability, flexibility and range of movement, and we need to remember not to take advantage of this greater range of movement and flexibility. We need to be aware of the higher risk of injury during this time. So thinking about exercises that promote good technique, analyse even the most basic exercises for their technique and how they're being performed for a woman that's either antenatal, postnatal, and definitely still breastfeeding. The second one that we need to consider is discomfort. Now, for women breastfeeding, they're producing a reasonable amount of milk. They're going to find that their breasts are really heavy and potentially very uncomfortable. So when you're asking them to exercise, we need to take this into consideration for the types of exercises that we choose. It's recommended by health visitors that women often breastfeed before they exercise to help empty the breast slightly and make it a little bit more comfortable for them. So that's something to discuss with your client if it's been recommended for them. But when it comes to the actual exercises, just think about the suitability of what you're asking them to do. Make sure you typically keep it low impact unless, of course, the client is very familiar with high impact exercise and wishes to return. And avoiding obvious exercise choices like prone lying exercises, so nothing that requires someone laying on their front. So the third consideration that we need to remember is how many calories the client's likely to burn, because with breastfeeding, it's been reported that they can burn up to 500 calories for just breastfeeding alone. So take on top of that their basal metabolic rate, and then the exercise that you're going to be encouraging them to do, we need to make sure the client is aware of that so that they can appropriately eat and make sure their nutrition is right for the type of exercise, especially if this person is going to be exercising on a regular basis, which we hope all ante and postnatal women will. So think about discussing that element with your client, making sure that they're familiar with their calorie consumption. And the final consideration is postural exercises. So we talk about postural exercises throughout the ante and postnatal period, but focusing more specifically on women that are breastfeeding, we want to focus on the postural changes that occur with that particular change in their life. So we might see women become slightly more rounded shouldered as they carry excess weight in their breasts, but also the way that they have to sit to breastfeed. So being aware of that, teaching them essentially how to sit well, so shoulders back and down. If people aren't familiar with it and they're not thinking of it, it's not in their conscious, they're not going to make a conscious effort to improve it. So for example, if I'm sitting here now and I'm sitting more rounded shouldered, I wouldn't think anything of it until someone said to me, sit back, sit back, sit upright, shoulders back and down. And then in which case I would be like, yeah, I do need to sit better. So making sure that you educate your client, make them familiar with the changes to their posture so that they can become more aware of it in everyday life. They don't want to just be working on postural changes when they're in the session with you. They want to be able to translate and put that into everyday activity. So thinking about the changes for the upper body and minimizing the likelihood of kyphosis. But also, as the baby gets a bit older, they may change how they start to carry the baby. So rather than in front of them, they might start carrying the baby to the side. And then we can see changes in some women which involve an anterior pelvic tilt and a lateral pelvic tilt. So we're tipping slightly more to the side. Again, making the mothers aware of their posture whilst they hold, carry, lift a baby is going to be important, and trying to work on making sure we strengthen and stretch the appropriate muscle groups so that we don't see any of these changes. So for you as a fitness professional, when it comes to this section, it's analysing their posture as it is now and seeing where you can make improvements. Not forgetting that there probably are improvements to the lower part of the torso, because during pregnancy we see a more lordotic curve. So you might be rectifying those changes, also being aware of the changes in the upper body, and then possible lateral movements going forward. So analyse that and then educate your client so they can become more aware of what they're doing on a daily basis. So those 4 considerations include 1, the hormone relaxin being in the body for at least 5 months post-pregnancy, but normally for the duration that someone is breastfeeding, so that can be anywhere up to 2 years. The second consideration was discomfort and heaviness of the breasts, being aware of the exercises that are going to be best for that particular client and potentially discussing the likelihood of breastfeeding before exercise. Number 3 was the additional need for calories, because calories are burnt during breastfeeding, so we need to ensure the client is consuming a suitable amount of calories for the exercise they're going to be doing on top of their daily activity. And the last one was making sure that we address postural exercises, because there are many different postural changes that occur as a woman develops through pregnancy and into the postnatal period, and different postures that will occur with breastfeeding alone. So I hope you found them interesting. If you have any comments or questions, then write them in the comment section below, and I'll see you soon.